Hi, I'm Hilary DuBrock, and I'm a pulmonologist and PH clinician at Mayo Clinic in Rochester, Minnesota. And today I'd like to talk to you about reflection on the impact of the COVID-19 pandemic on our clinical pulmonary hypertension practice. So we're now at the end of 2022, and we've all been through a few years now of the COVID-19 pandemic, which has really changed, I think, how we practice medicine, both in the outpatient and the inpatient setting, and how we care for our patients with pulmonary hypertension. And I think to focus on the positive, we certainly could go on and on about all of the negative impacts of the pandemic, but to focus on the positive, I think one thing that has changed with our practice is the openness to telemedicine and telehealth, which I think is certainly much more convenient for patients. There's still value in seeing patients in person, and we see the majority of our patients at Mayo Clinic in person for face-to-face visits because I think that's really important and is seeing patients on a regular basis. But we are certainly now more open to both phone follow-up visits and video medicine follow-up visits, which is, I think, a great opportunity for checking in with patients to see how they're doing without them having to travel back to the hospital, particularly for some of our patients that live far away or it's hard for them to get into clinic. So I think that's been a real opportunity that we have taken advantage of that's been very valuable. Patients tend to express, satisfaction that they are able to see us and check in, and we can make modifications or tweaks to their regimen and really just feel like they don't need to wait till their next appointment to come back and see us or talk to us about an issue or concern related to their medication or other factors. And so I think that's been a real advantage to having more openness to telemedicine. And then I think there's also been, in addition to telemedicine health visits, things like remote pulmonary rehab programs where during the pandemic, pulmonary rehab really shut down because of concerns regarding patients in COVID-19 and concerns regarding transmission of infection. And I think people have kind of taken that and developed different kinds of remote pulmonary rehab programs, which is really important so patients can remain engaged in exercise and physical activity without needing to go to a specific center, which might be both inconvenient and also expensive to travel to places if they don't have a pulmonary rehab center nearby. And that's actually one of our areas of research that we're looking at is how can we optimize remote pulmonary rehab programs to help our patients with pulmonary hypertension. We're doing a study on that right now and also doing a survey trying to get patient perspectives about remote pulmonary rehab. But I think we still have a lot to learn about how to use telemedicine in the management of pulmonary hypertension and things like pulmonary rehab. But I think it's a big opportunity for our patients to just have more convenient care. I think during the pandemic, people were reluctant to come in and, may have also been reluctant to adopt telehealth options. And so there are certainly patients we had who might have gotten lost in the shuffle and that they needed follow-up and didn't have an opportunity to be able to come in. The majority of our patients, though, I think we were following up with them either over the phone or on video, and they're on long-term medications, so we're monitoring them. And I feel like we did our best to keep a close eye on all of our patients so they didn't fall through the cracks. And I think that was really important and kind of a challenging aspect of medicine during that time is you weren't seeing patients in person, but they were still out there at home and needed to be taken care of. And so how we did that, I think, was a learning experience. And then I think probably the biggest disadvantage with the pandemic and access to care was for patients with new diagnoses because they weren't getting in for new clinic appointments. They didn't have an established provider, and it was hard to get in for specialists and even primary care appointments. And so I think we don't know, but certainly the pandemic could have impacted overall delays in diagnosis because patients who didn't have an established PH diagnosis didn't have a care team or someone to really reach out to them. And so I think that's a major problem with the pandemic that we don't really understand the impact of, but I suspect there were delays in diagnosis. And I think moving forward, finding ways to improve those delays in diagnosis are really important so this doesn't happen again. I think, not just telehealth, but varied remote monitoring tools will be really important in pulmonary hypertension moving forward. And that could be things like your Apple Watch telling you what your oxygen saturation or your heart rate is, and being able to do things like remote 6-minute walks and having an app where you log your symptoms or your quality of life, and that is uploaded to your provider. And knowing how to incorporate those into our clinical care, I think, is an ongoing area of research. How do we use this information? But I think it's really important that we develop ways to use it because it reflects the patient's daily life. It reflects how they're living at home and not just when they see you, once every 3 to 6 months in clinic. And so finding ways to incorporate that into our clinical practice and reflect their overall daily lives and what they're doing at home and how they're living and functioning on a day-to-day basis is obviously important to how we're treating and managing their pulmonary hypertension. And so the remote 6-minute walks and remote pulmonary rehab and apps and devices, and it's kind of information overload, but I think it's important to have a way to incorporate that into our clinical care of patients. I think the pandemic affected mental health in a kind of interesting and surprising way in some patients. And so certainly I had patients who just felt very isolated, and that led to depression. And they were, particularly Minnesota in the winter, where couldn't go to the gym, were less able to do physical activities, cold outside. And so I think, I certainly had patients that had worsening depressed mood and just feeling like they didn't want to do much anymore. And I think it was because of the social isolation and not being able to be as physically active that it just impacts your mood. But on the flip side, which I did not expect, was I also had some patients who I think appreciated time at home with family and actually felt less stressed, which I never would have predicted. But I do think that there were some patients who had kind of the opposite of what I expected to be a response to the pandemic, in that they actually had improvement in their mental health because there was less kind of external stressors to them. And it was just kind of a spectrum, I think, of responses in terms of mental health and depression. But I certainly was surprised by some patients actually feeling like they were more connected to their family, less external pressures and responsibilities and stressors, and actually felt like they could focus on their disease management, but also their home life more. And so that was kind of again, I like to focus on the positive, but that was kind of a positive, unexpected finding. Thank you for listening. This has been Dr. Hilary DuBrock, and I'm aware that my patients are rare.